Hello everyone, my name is Sherifat Abdusalam. I'm here to perform IV fluid and medication administration. I have the proper attire on, my badge, no nail polish, no jewelry, and I have a wristwatch. First thing I'm going to do is to verify the physician's order and make sure that it aligns with the medication right, which is to have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. After that, I'll check and do my calculation. There are two orders. The first order says to give normal saline 150 ml per hour, and the second one says to give amoxicillin 250 milligram IV in 100 ml normal saline over 15 minutes. What I've done is to do that calculation. For the fluid, the order is 150 ml at 15 GTT over 60 minutes, which is the hour. It came up to 37.5, which I round up to 38 drop per minute. For the medication, the amoxicillin, it says to administer the amoxicillin 250 mg in 100 ml over 15 minutes, which is 100 ml by 15 GTT over 15 minutes, and that one came down to 100 drop per minute. I'll reference this along the line in the video. Next thing, once I confirm the order is right, I'm going to gather my supply. I have my aqua swab, I have my gloves, I have this label which I'm going to put on the secondary IV, which is the amoxicillin medication, just to show record of the drop factor and all that. Then I have my amoxicillin bag, I have my normal saline bag, then I have my tubing. I have the tubing that have the white side, and I have the regular tubing that is going to be used for the amoxicillin. For the tubing already have a drop factor of 15, and then same thing for the second one. The drop factor is 15. And then for the tubing has different chambers, and the first part of this is to have this spike end. This spike end, because this technique is aseptic, so this spike end cap had to be on until the time we're ready to push it through into the medication bag. It has to stay on. Then we have the drip chamber, which is where we're going to push to have the medication into before we can now do the drop factor. And then the next thing there is to have the roller clamp, and this one is what we use to control the drip factor, or even to stop the medication when it's been administered. This is open right now. I'm going to close it so that when I connect it, it won't just overflow and run over. And then the next thing is the Y side. This side is where we're going to connect a secondary bag, or the piggyback. We're going to connect that, or if the doctor order medication to be administered directly, this is the point where we're going to administer that. And then we have the adapter end. The adapter end is the port where we connect to the patient's IV line. This is the part where we connect to the patient. Same thing for the second IV tubing. We have the spike end, we have the drip chamber, we have the roller clamp, and then we have the adapter end. And then this one has a blue clip. That one is also like a stopper for the medication. You can use it to clip the tube, and you can release it if you want to release the medication. Now that I have my supply, I'm going to gather all of them. I don't have a physical patient, but I'll verbalize. So I'm going to gather all this, go to my patient's room, knock, go in, provide privacy, introduce myself to the patient. My name is Sharifa. I'm going to be your nurse today. Identify the patient's two ways with their name and date of birth, and also use their wristband to identify them. And then explain the procedure to them. Find out if they have any known allergy, which my patient just told me they don't. Explain to the patient that the the doctor has ordered an antibiotic for them, that everything is going to take about 45 minutes for the whole medication to be administered. If they have any question, patient said no question, asked if you can go ahead, patient gave consent, and then I'm going to perform hand hygiene and wear my gloves. Once I've worn my glove, I'm going to then I mentioned I don't have a regular pole, so this is my improvised pole. I've already set this pole at 30 inches from the patient IV site, and then I've arranged it such that the two bags, the primary bag will hang lower and the secondary bag will hang higher than the primary bag. So to prep the medication now, I'm going to start with the normal saline, which is the primary medication. And then before setting this up, I've already checked the two medications to make sure they are not expired. I'm still going to perform my medication right. I have my right patient here, which I verified with their name. The medication, I have the right drug, which is the normal saline. The right dosage is to administer this at 38 GTT per minute, which is the drop factor, and then the route is the IV route, and I'm giving it at the right time. So for this bag, it has two ports. One port is to instill medication inside the bag, and the other one is to use the spike end to administer medication. So I'm gonna put this on my non-dominant hand. I'm gonna use my dominant hand, which is my left hand, take off the cap on the spike end, and then I'm gonna push that through. I'm gonna push that through, and then I'm going to hang this. I'm gonna push the drip chamber just to have some fluid in it, and then like I said, I'm going to hang this below. Even at this low level, it's still 30 inches over above the patient IV site. And then the drop factor is 38 drops per minute. I have my receptacle here where I'm going to have the water dropping, and then I'm going to calculate the 38 drops per minute using my watch. Okay. Okay, that's 1 minute. At this point, I'm going to close. I'm going to use the roller clamp to close that. Since I've just administered this medication to the patient, I'll make sure I check the IV site to make sure the integrity is still intact. There is no swelling, there is no irritation, and I'll check that the patient is not complaining as well about the medication that I just started administering. Once that is going on, I'll take the second bag, which is going to be our amoxicillin. Doctor's order is to have 250 milligram amoxicillin IV in 100 ml normal saline over 15 minutes. And once when I calculated that 100 drop per minute, so we're going to do that same process. I'm not using the medication clamp. I'm using the other clamp, and I'm going to put on my non-dominant hand. And then once I'm about to start, I'm going to take the cover off the spike end, and then I'm going to push that through. Once that is true, push the drip chamber to make sure some water is falling through. And then I'm going to hang this higher above the primary piggy bank, primary bag, which is the normal saline, and I have this amoxicillin. At this point, I'm going to take, before calculating my drop factor, I will connect the adapter end to the Y side here. So for this purpose, I'm going to clean the end of the Y side. Make sure it's clean with aqua swap. Make sure it's clean. And then clean this. And then once clean, you also want to make sure it's dry. I use this technique to check the dry. All right, it's dry, and I'm going to take and then connect. Once connected, remember this is still on the patient. Once that is connected, then I can now set the medication. So for this medication, I've also done my medication right, as in that's the amoxicillin. I've confirmed the right patient. The right medication is amoxicillin. It's 250 milligram dose, and we're dropping that at 100 drop per minute. And then the route is through the IV. Is the right time, and then I'll document after. So, and then I'll now calculate that. And then it's 100. Okay. Minute. So once that is done, The medication is now through the Y site is now being administered to the patient, and still I'll make sure to check the site because I'm giving this the patient, even though that they confirm that they don't have any known allergy. I'll still wait around to ensure that they are not reacting to the medication, that they are not experiencing any irritation in the IV site that the medication is going through into their body. I'll also ensure to find out if they are having any discomfort. If they confirm there is no discomfort, I'll gather all my used supplies. I will clear my table. For the medication, like I mentioned, I will attach this orange paper to it. It's just for record purpose to show the time the medication was started, the drop factor used, and the order and the name of the medication. And once that is done, I will gather the supplies as mentioned, place the patient in a comfortable position, place the call bell close to the patient, make sure the patient is fine, ask if the patient need anything. Once they say they don't need anything, I will remove my glove, perform hand hygiene, and then go document. My documentation is going to show the time the medication is administered, the way the patient is tolerating the medication, the expected time to check the patient, and the follow-up that I'll do after. Thank you.